Head to Toe Healthcare has you covered from head to toe. We've talked about this before. There's a doctor that performs podiatry, and the optometrist is Dr. Z. She's our guest today on the Business File. Dr. Z, there's all sort of new things in eye care. DNA testing is something I know that has been applied to all kinds of different areas in healthcare. Has eye care adapted this kind of genetic testing?
Absolutely. The most recent one for the last several years has been the DNA testing for macular degeneration. So basically it's a quick, easy test that you can get. Basically it's a swab of the cheeks that you can get, and then we just send it to the lab, and you're going to get the results back within about 4 to 6 weeks, and then we're going to review the results with you. And in the results is very outline detailed about what the progression of the macular degeneration, if the patient is at risk within an X amount of time, and they also give you a certain recommendation and protocols of what testing and supplement for that.
That's very good to know, to help you out, even though you know there's a family history, you want to know how it applies to you.
Yes.
So is there a similar test for, in Arizona we deal with dry eye syndrome here?
Yes, totally. Another new test that I've introduced in my practice is basically what we call the screening tools for the dry eyes patient. And I actually have a sample of one of my patients this morning was kind enough to let me use her kit for it.
Oh,
so
funny.
I always joke around with my patient. It's like, looks like a pregnancy test.
It does.
Okay, so it's basically peels off, and all you need to do is basically just swap it on the lower lid. Okay, and then put it in there, and then we're going to dip it in this, and you get the result within the next 10 minutes and by the end of the test.
What kind of treatments are there for dry eyes? I know there's artificial tears and supplements. What can we do to help us?
Another new, not new thing, another thing that's been out a while is basically tear serums that I've been introducing to my patients. So basically, if the patients with dry eyes have tried all the means that they have, so the tear serums is basically you are producing it through your blood.
Very
You have to like separate the red blood cells from the serum, and they come in a sterile syringe.
Dr. Z can tell you more at Head to Toe Healthcare across from the Foothills Mall. Go to their website, which is headtotoehealthcare.org, or call them today, 441-6508. Sure, we can watch that back. Do we need to go in here? Do you feel like you got all the information in that you wanted?